Excellent. Parag, before we get into the exciting work you are doing today and what's ahead, I'd love to take a step back and hear about the beginning of SpineX. Every great innovation starts with a story, often a personal one or a powerful need that hasn't been addressed. Can you share with us how SpineX came to be? What was the original inspiration behind founding this company?
SpineX for me has been a life's journey. I've been personally involved with this technology for now coming up on 17 years. So better part of my adult life I've spent in developing this technology right from its early grassroots levels to where it is today. But if you take a step back, this is not something that happened overnight. It's been a life's journey for not just myself, but also a lot of our team members who spent several decades in understanding the basic science behind this and exploring the possibilities, testing this at various levels before bringing this to patients that would benefit from this. So all in all, it's a culmination of decades of dedicated hard work, research, blood, sweat, and tears that have gone into developing this technology and making it available for people that desperately need it.
Yeah, I know you've been deeply involved in research and development in this field for a long time. What made you believe that neuromodulation, specifically non-invasive spinal cord neuromodulation, had the potential to change the game for people with neurological conditions?
As I said earlier, I think our technology is deep-rooted in science. And the primary question that's been driving our thinking all these years has been, what is the data telling you? There is obviously early skepticism if non-invasive neuromodulation would work, and knowing that neuromodulation has primarily been an implantable technology and we require a surgical intervention for neuromodulation devices to be used. So, there was a lot of pushback trying to, understand if non-invasive neuromodulation would even work in the first place. But all these years, the one driving factor, the one question that allowed us to focus was, what is the data telling us? All of our studies, all of our patients, all of our clinical trials and preclinical trials told us one simple answer, which is that non-invasive neuromodulation has the potential to treat the underlying condition and not just manage symptoms. And that really was the driving factor in pushing the boundaries and allowing us to get this to the next level.
What were some of the biggest challenges you faced early in bringing on SpineX from an idea to reality?
As an early stage company, we were the new kids on the block, but while we had multiple hurdles, multiple challenges, both from a clinical, a regulatory, and acceptance perspective, we had our roadmap identified. We had identified our goals and milestones that we needed to achieve. And I think every step along the way, gaining the confidence of the key stakeholders and demonstrating to them that this technology is actually answering the questions that they have been, providing them with answers to the questions that they've been looking for. I think allowing us to, take just one step at a time really allowed us to get past those initial challenges.
Looking back at those early days, you mentioned, what were some of these moments where you thought, yes, we're onto something that could really change lives?
I think one of the main driving factors and the aha moment really was seeing the technology in action. And this is something that's quite remarkable about neuromodulation. It is not something that takes months or even years to see an effect. The way neuromodulation functions is it allows us to see the impact almost instantaneously. And that's just how the technology is functioning. It's how it's developed. And those were the moments that kind of told us that, yeah, we're onto something here. This is not magic. This is not something that you're imagining, but this is real. And allowing us to see it in action firsthand, and not just looking at data, but also hearing what the patients are telling us and hearing their side of the story, told us that, hey, we're onto something.